Hi, welcome to another episode of Beyond the Eyes, Understanding CVI, where we provide valuable information for parents, caregivers, and educators. In the last episode, we discussed what CVI is and how it impacts everyday activities. In today's episode, we'll focus on the number one question parents ask next: how can I support my child? The good news is, there are many effective strategies, and support doesn't rely on one professional alone. Let's get started. Interventions for CVI are not about fixing vision, they're about supporting how the brain processes visual information. Children with CVI benefit from early, individualized, and coordinated interventions that focus on their participation in the daily activities we mentioned in the last video: play, learning, social participation, and functional mobility. This is where occupational therapy and teamwork across disciplines play a major role. Children with CVI often receive help from a team that includes medical, allied health, and education-based disciplines. This chart highlights many of these professionals. From the medical side, children with CVI may receive help from pediatricians, ophthalmologists, and/or geneticists. Let's dive into these professions a bit further. Pediatricians help with early identification and referrals. These professionals may spot signs of CVI and refer you and your child to an ophthalmologist for specialized eye and neurological exams. A pediatric ophthalmologist will provide an in-depth exam to rule out eye disease and identify any other ocular concerns that may exist. These professionals will also diagnose CVI, address any treatable eye conditions, and prescribe glasses or refer you and your child to low vision rehabilitation if needed. Lastly, a geneticist will investigate if a specific genetic condition, including particular inherited disorders or syndromes, is the root cause of the CVI. Now, let's take a look at the disciplines involved with allied health. These disciplines include occupational therapist, physical therapist, speech-language pathologist, and orientation and mobility specialist. These professionals may help with communication or AAC devices if needed, and design vision or mobility-based interventions that help your child to improve mobility and participation in their daily occupations. Lastly, teachers and special educators make up some of the education-based help your child may receive. These professionals help by modifying the learning environment, adapting materials, and using multisensory strategies to reduce visual clutter and fatigue. Each discipline brings a different perspective and sets of interventions, but the most effective intervention happens when everyone is working towards shared functional goals. Remember, parents aren't just part of the team, you are central to it. Before we jump into types of interventions, it is important to note that some symptoms may be less suitable for particular types of interventions. Like we said in the last video, many children with CVI experience seizures, which are not inducive for many interventions involving strobing or flashing lights. Children who have CVI and cerebral palsy with other symptoms will also require interventions more suited to their specific needs. Ultimately, interventions should be carefully tailored for each child depending on severity of CVI, symptoms, and overall comfort. Environmental and daily routine supports. These types of interventions focus on adapting the environment to reduce visual demands. These may include reducing visual clutter, using high contrast materials, adjusting lighting, presenting items one at a time, and allowing extra time for visual processing. These changes help children use their vision more efficiently and with less effort. Vision-focused and sensory-based strategies. Some children benefit from visual stimulation activities, such as using preferred colors or illuminated objects, encouraging visual tracking through play, releasing shapes into designated slots, and using movement to support visual attention. Others may benefit from structured spaces, like color tents, which reduce visual noise and support attention. These strategies are carefully tailored so what works for one child may not work for another. Supporting movement and mobility. Physical and occupational therapists may also work on safe navigation through spaces, balance and posture, coordinating movement with visual input, functional mobility during play and school activities, and reaching bilaterally across midline, or the invisible line that runs down the center of their body. These skills support independence and confidence with movement through their environment. Children with CVI can face challenges that are not easy to see from the outside. Moment-to-moment changes can happen due to clutter, fatigue, lighting, noise, or how visually busy a space is. One of the most important things parents can do is learn about CVI and share that understanding with others. Knowing how CVI affects your child helps you explain their needs to teachers, therapists, family members, and healthcare providers. This helps shift the focus from what's wrong to what support is needed. Accessing the right resources can make a meaningful difference. Simple changes, like the ones we've already mentioned, including reducing visual clutter, adjusting lighting, allowing extra time, or presenting information in a different way, can help your child feel more successful and confident. Here are some simple action steps to try. Number 1, make note of symptoms you observe in your child. Whether you notice your child having difficulty with day-to-day tasks or tripping over rugs or toys. Number 2, share what you notice with others. If your child is under the age of 3, this starts in early intervention. If your child is 3 years old or older, help begins in the school system. This will be explained further in the next video. And lastly, number 3, ask for support and accommodations. Request classroom or therapy adjustments that reduce visual stress and support participation. In our next episode, we'll talk about self-advocacy and explore resources, accommodations, and supports available to families, as well as how to access them. Thank you so much for being here. If you found this video helpful, please like, share, and subscribe for more content on navigating life with children with CVI. Together, we can make the world a more inclusive and supportive place for all children to thrive. See you in the next episode.